Hey, good evening, everyone, and welcome to another edition of Let's Talk About It. This is Susan Johnson, and my co host is out running for office. Dennis O'Brien will be running for the Willimantic Taxing District Board this time, and so he won't be with us until after the election. But we have a wonderful guest for you this evening. We have a wonderful guest who is in charge of the Homeless No Free Shelter. And I just want to say thank you so much for being with us, Mrs. Leonhardt.
Hi. Thank you for having me.
Thank you for being here. And we have great news. So you're in the process of opening up the shelter again on November 1st.
Yep. So we are getting ready to open our shelter for another shelter season, and we're really looking forward to it. As you know, last year, a year and a half ago, we purchased a building, and then the Foster Family Foundation paid our mortgage for us, and so we are just so incredibly grateful to them for the support that they've shown us and the help that we got with getting that building. And since that time, we actually bought the smaller building next door, and this is so that we can have more of a campus. And I'll talk more about the renovation project in a bit. But first, right now, what we're doing is because of upcoming renovations, we are moving our shelter services over to the smaller building at 459 Valley Street, and so that they can start renovating the main building at 433 Valley Street. So I just came from there. We were setting up beds thanks to ARPA grant funding from the town of Mansfield. We were able to buy all new beds, and we're having some construction work done in there just to make it all safe, up to code and up to fire marshal standards and things like that. We're very excited. We've had a lot of support from the town on this project, and it's going to be a good season. I'm looking forward to it.
Well, thank you so much for your hard work on this. I know that it's been a wonderful thing that you've been doing, and you're really in touch with people who need to make those transfers from homelessness into housing. And it's having you here so that you really understand the systems and the process is really valuable to all of us, me as a state legislator, but also to people who are working on these issues. And I just want to say thank you for that work and helping out people who have a lot of needs. Maybe what you could do is tell us a little bit about some of the profiles of the people who you're helping at this point in time with homelessness.
So at our shelter, we serve adults only, and that's anyone age 18 or older. And we have a variety of people. Right now, we're seeing an uptick in the number of people who are over the age of 60. And that's concerning because that tells us that we have people who are not getting the support that they need as they age and as maybe they leave the workforce or something like that. Rents are going up. Many people are on fixed incomes. And when rents go up, they can't afford to stay where they've been for many, many years, perhaps. And so that's one part of the population that we're seeing. We're also seeing a number of young people. And so for us, youth is anybody who's up to the age of 25, so between 18 and 24 years old. And we try to get them situated in a place where they can get support that's specific to their needs. Some employment help, maybe if they need a GED or to go back to school or something like that, they can get that kind of support that is specific. So we work with other agencies that provide services specifically for them. And yeah, profile, we have every story you could think of, and some that you never would imagine.
Well, that's excellent, because I think that one of the things I've found is that a lot of people are very, very surprised that our population that's growing older, our senior citizens, people over 60, and people who are, actually retirement age of 66 or so, are actually finding themselves without housing, as well as the surprise has been, and I learned this several years ago when I was working on the higher education committee with respect to college students. We have students who are going to college living in their cars, and they are also homeless.
When we run into a situation like that, I usually will contact somebody that we know at UConn or at Eastern, depending on which school they're at. And we've been able to help them in that way. The colleges are wonderfully supportive of the No Freeze. They send us volunteers, student volunteers, and things like that. And we really have a wonderful relationship with both the colleges and QVCC. And so they're wonderfully supportive of us, and if we have a college student, we can usually find a way to keep them out of shelter and off the street. So
That's wonderful.
It's a good thing.
That's really good to hear. I know it was quite a big surprise to people when I started working with the chairman of the Higher Education Committee, Greg Haddad. Representative Haddad had mentioned there were homeless students at UConn and around the area. And so I just thought that was a surprise. But also now the growing number of senior citizens who are homeless is also a surprise, because I guess the housing shortage and the income shortage, the low-income population situation is kind of colliding, making this situation much, much worse than it's ever been, actually, my recollection, that is.
That's true, and we're also seeing more and more people who are experiencing homelessness who are actually working, and working full-time, but just don't have enough money to make ends meet, can't afford a rent in this economy. And especially if you're working at a minimum wage job, it's very, very difficult. So even some of my staff are working 2 jobs because it's just hard. It's very hard out there right now.
I know we worked hard at the Capitol to raise the minimum wage to the 15. We fought for the 15, but really the wage that you need is somewhere around $25 to $30 an hour.
Exactly.
If you're going to be able to afford an apartment, then you need to be able to make that kind, unless you're going to show that you can get a subsidy, a Section 8 subsidy, which there's a big limitation on those as well.
Right. And, honestly, not everyone should need a Section 8 subsidy. Those should be for people who really genuinely need them. And so that should not be a goal unless you are somebody who, for whatever reason, can't work because of a disability or something like that. It seems like it just seems like we should be able to work at one job and be able to afford rent.
Well, I hear what you're saying, but the Section 8 subsidy actually is a subsidy for the corporations that keep the wages low. So if you have a subsidy, whether it's through the Medicaid program or through Section 8, any type of government subsidy for people who work is subsidizing the corporation that's keeping the wages low.
Yeah.
And that's a real problem in terms of how we operate our economy. And of course, as we know, and not to get too far sidetracked off, but when you have a lot of monopolization of all the goods and services, then what happens is there's no competition, and it drives the price up. And we know what's going on with housing. The banks are buying up the housing. The hedge funds are buying up the housing and driving the cost up. So we have that right here in town, where the hedge funds have been purchasing a mobile home park. They purchased the 580 Main Street and the building next door. So the bigger buildings are being purchased by hedge fund operators, and they're raising the rents beyond what even would be considered market rate. So a person could get a Section 8 subsidy.
Yes, right. And yeah, I agree. And I hear also in the Danielson Putnam area that this is happening quite a bit with a lot of the residential apartments where they're being purchased by somebody who flips them or just purchased outright. I know that landlords have suffered with COVID. A lot of them really struggled because they weren't necessarily getting rent from their tenants for a long time. And some of them are just ready to be done. And when a big corporation comes and dangles a lot of money in front of them and says, let me take that property off your hands for you, it's very tempting. I can understand why they would say yes to that.
Absolutely, and that's a problem. So you've got them also in the quiet, way up in the quiet corner, but you've got them all over Connecticut and all over the country, basically buying up properties and driving up the cost of housing. And they know right now in Connecticut we're about 120,000 units short of housing opportunities for people. 120,000 units. Now, this didn't happen overnight. This has been going on for the last 40 years when former President Reagan actually got rid of the Department of Housing and Urban Development's building of housing and just created the Section 8 program, which is nothing wrong with the Section 8 program providing subsidies. On the other hand, not providing any more new housing for different groups is a big problem, and that's kind of what's happened over the last 40 years or so. So losing out on that housing is something that we're really in a jam about, and that's why we're so pleased that you have the No Free Shelter here, which has been a no free shelter since Reagan, I think, was in the presidency and cutting back on everybody's social safety net.
We are 20 years old this year, so it's been, and we're really growing now in this big way with the new buildings and the big renovation project, and we're excited about it because we're going to be it's a very different model, and we're really excited because the renovation project is being funded by COVID money. And because of that, instead of having a large room with all these beds crammed in there, we're ultimately going to have small rooms where people will be, they will be double occupancy rooms with their own bathrooms. And that's really nice because sometimes people come into shelter and they're already experiencing some kind of trauma from being homeless. And now they come into this big room with all of these strangers. And I don't know about you, but I would find it very difficult to sleep in a situation like that. And so this gives people a sense of dignity, a sense of privacy, and it's going to be really nice. I'm so excited about it. Plus, there will be space for things like doing laundry, and we'll be able to still provide showers for people who are sleeping outside. Hygiene services and things like that. They'll be able to come in and still get services. So it's going to be great. Yeah.
Sounds wonderful. It sounds like you've really worked very, very hard at this, trying to make sure that you have this nice expansion. And so tell us a little bit about the renovation and how the project will work. So you're kind of coordinating the buildings, fixing one and then the other.
Right. So we're going to go to bid soon for a general contractor on the project. And we have, like I said, there's the large building at 433 Valley Street, and there's a smaller building at 459 Valley Street. They're right next door to each other, and we'll just merge the parking lots. In the end, what will happen is, as I described, the larger building will have these micro units with bedrooms, smaller rooms for people to share, and some open space. It will also be fully ADA compliant, so we'll have an elevator, we'll have a sprinkler system. Everything will be up to code standards now, and I'm excited about that too. And then the smaller building will be our administrative offices, but we'll also have day services over there. So there's going to be a resource room where people can come in and use a computer and have some help if they need it to apply for jobs or look for housing, search for apartments, or whatever they need to do online. Like it might be even, getting their SNAP benefits fixed because something went wrong. A lot of that stuff is done online now, and a lot of people need a little guidance with that. So we'll have volunteers there. We also hope to offer some clinical services. We've talked with both Generations and Hartford Healthcare, who are willing to send us some support in the, perhaps an APRN or a nurse or somebody who can come during the day and just help people with maybe diabetes checks or getting a COVID test or COVID vaccination or a flu shot. Or maybe they're just, they've lost their medication, they need help getting a refill. Maybe they have a hurt toe and they just need somebody to look at it. That kind of thing helps people stay out of the emergency room for their primary care. So it's a huge cost-saving benefit. if we have somebody right on site that can help people.
So you're raising an interesting issue for me because one of the things I like to focus on at the Capitol is healthcare access, and so many of the people who come to the shelter are probably eligible for the Medicaid program.
Yes.
And so that would be something that you might help them apply for, or something where, if they're getting services at the homeless shelter, they would be able to have the Medicaid program pay the service provider for the services.
Right, yes. Yes, and we do help now with that kind of thing as people need it. Many of the people come to us already receiving Husky benefits, so they're which is good. That's helpful.
And so one of the things when you look at the Husky program, I know that I was kind of surprised that we have something called the CHESS program, which is a program that is supposed to help people once they're housed with some of the housing needs that they would need to stay in the housing, and that also is paid for by the Medicaid program. But my understanding is it didn't quite go very far this year.
So the CHESS program has been actually wonderful. We had a number of our guests who were eligible, who applied for CHESS and were able to receive it and are now housed. So the CHESS program, yes, is a two-part program. It provides first a housing subsidy, like a Section 8 voucher, so they can go into housing, and then they also have wraparound services. So that means a case manager who's going to help them with their daily activities to whatever they need. Whether it might be arranging to have a visiting nurse to help them with medication, or it might be helping them get to their appointments, or it might be just somebody who can help them figure out how to get to the grocery store if they need to, So that kind of thing is really, really helpful. And so the CHESS program, unfortunately, not long after they opened, a lot of people applied, and they were able to get a lot of people a subsidy, but then they ran out of funding for the subsidy. So where we are now is that if we can help somebody with a Section 8 voucher or some kind of subsidy, they can still provide, we can apply for them to still receive wraparound services from and support services from CHESS. And I heard that they may be opening up again, but I'm not sure for the housing subsidy. I hope so. Right now, I haven't heard much, but I heard that they're trying to do it again because it's really a wonderfully successful program. And mostly because for somebody who's experiencing homelessness, attending to their health care needs is kind of a lost cause. If you're really sick and you're outside, you need to be inside. And so this is a way for people with chronic illnesses or some kind of disability to be stabilized so that they can attend to the health care needs that they have.
That's exactly right. And that is one of the things I know that when I was going with the Medicaid director to the Milbank Foundation meetings on healthcare, Arizona actually, strangely, was the first state to do a CHESS program. But the focus generally is on Medicaid beneficiaries who actually cost the state more than $40,000 a year because their overall condition is so compromised,
Right.
and that they found that if you're housed, you're not going to be as ill.
Exactly.
That was a surprise to people. I'm sorry. Really?
It is kind of funny.
Yes, it's absurd. But anyway, I mean that is the kind of absurdity we're faced with in the society today because of the lack of a good social safety net for people that have all kinds of problems. And what probably landed them in the homeless situation in the first place was they had a heart attack. We've had people come to the Capitol who suffered heart attacks and then were discharged from the hospital to the riverbank instead of to a nursing facility or trying to find a home for them, which has been quite a thing, or discharged from the hospital to the homeless shelter. And this is something I raised again this year in the Appropriations Committee and in the Human Services Committee. And as you might remember, I also serve on the Medical Policy Oversight Council. and that we were actually speaking with the Commissioner of Human Services and the Director of Medicaid and the person that helps with these issues. And they had not really been fully informed about the fact that people were being discharged from the hospital to a homeless shelter or to a riverbank. And because sometimes people, they work all their lives in places where, maybe they're not making that much money. They're paying their rent every month, and then boom, they get sick and they go to the hospital and they come back and they can't afford to pay the rent while they're in the hospital, and they've been gone so long that they lose the place to live. And then they're homeless, and not, the discharge plan does not address making sure someone is moved from the hospital to a home someplace, and they end up in the homeless shelter. So you want to tell us a little bit about some of those that you might have had?
We have had that happen, and it's always frustrating when it does happen, particularly if the person is physically compromised when they come to us. They might have whatever staples from a recent surgery or something like that. That's for us, that's very difficult because we don't have the capacity to care for that person in the way that they need to be cared for. I will say this, that we've got a wonderful relationship with the ED at Wyndham Hospital and also at Bacchus. And they do make every effort not to discharge to us. They have done it. It's not, but they let us know. They call us and they say, this is the situation and we just can't find a workaround. And so I'm glad that they do that because it helps us sometimes we can help brainstorm with them over the phone. I certainly understand why it would be difficult for a hospital who has to discharge because they can't magically find an apartment for this person either. But I do get concerned when they discharge somebody who is very, very compromised and maybe isn't ready to be, who would typically go home and go to bed for a few days, isn't typically ready to be up and around and things like that. So it does happen. We try very hard to work with our other providers and the hospitals. We are trying to pull together a community care team, too, with the hospital and Generations and us, because the three of us are right there, and try to be able to kind of anticipate these problems before they happen so that there's a solution.
I have to give you praise for finding that location for the shelter because it is located in the perfect spot between the hospital and Generations. And it really gives people who have these medical needs a chance to get the treatment, and it's not very far away. And so it gives you a chance to work with everybody in the healthcare profession. And I think that's a very good spot that you've been able to find, and it's going to be a help for people making these transitions with these many of them very serious healthcare needs that have to be fixed. And so I have to say thank you for that. We're going to stop here for a minute for our break. This is Susan Johnson, and I'm here with Avery Linhart, and we want to come right back after these messages. Welcome back, everyone. This is Susan Johnson. I'm here with our very special guest this evening, the Executive Director of the No Freeze Shelter, Avery Linhart. Thank you so much again for being with us, and thank you so much for your good work because you are taking care of a lot of people who, I think back in the day when I was working for legal assistance to Medicare patients and at the Center for Medicare Advocacy, many of the people would have been in a nursing facility or intermediate care facility, and now they're forced out into the street or into a homeless shelter.
Yes, that's true sometimes, and it's a really tough place to be because you're, obviously not healthy as you could be, and there you are now having to live in a shelter with a lot of other people and a lot of other issues. So Hmm.
And it's not staffed like a nursing facility would be or intermediate care facility would be staffed. I mean, those are the kinds of places where, you have some nursing help and some nurses' aides, people maybe helping with physical therapy or some other types of things. And that's just not what a homeless shelter is set up for.
No, and even simple things like managing medications. So we don't have staff that does that. And so as a result, people have to manage their own medications, which is sometimes challenging. So it can be really hard for people.
How do they even have a place to put their medications?
Well, we give people lockers, so
Okay.
they do have a place where they can lock up their medications. And if there's a concern about that, or if we maybe are out of lockers at the moment and somebody has just come in with medications, we will lock up medications for people just to keep them safe, and they can have access to them when they need them. So,
Yeah.
yeah.
So this goes to the social determinants that we're talking about in terms of what creates the situation that causes the homelessness, and a lot of it is medical need, whether it's behavioral health issues or whether it's actual just cardiac surgery and then too long in the hospital, losing the apartment, and then not having a place to live and ending up being discharged instead of to a nursing home, to a homeless shelter.
Hmm. Yes, that's true. Behavioral health is a huge concern. Most of my population at the shelter have some diagnosis, one or another, and frankly, people are experiencing trauma or PTSD because they've just been through a trauma. If they've become homeless, that's a traumatic event in your life. It's not something that anybody is taking lightly. And so we have people who are struggling in many ways, and behavioral health is a big problem.
Mm-hmm.
Yeah.
PTSD, of course, is one of the things that, just to sidetrack for a minute, to another population of women and children who become homeless, and that's a growing number of people becoming homeless in our society because of the failure of our social safety net here in Connecticut and nationwide. But Connecticut was the second worst in the entire country for the temporary assistance for needy families, where we're only giving them 44% of poverty and limiting them to 21 months in a lifetime. And so now we have expanded the access to TANF beginning in April of 2024 to 36 months and increasing the amount of money to the federal poverty line, and also for people who are working, and most people in these circumstances are working, as long as they can hang on to the job and take care of the child and be homeless. This is a situation where we're going to have a little bit better opportunities for families in this circumstance. So it is a humanitarian crisis, and it's because we have shut down our social safety nets all over the country, and especially in Connecticut. I have to just say one more thing, that we used to have something called the Social Services General Assistance Program. And the General Assistance Program would help people stay in their homes if they lost their job or became ill. The Social Services Program would actually help people stay there so they weren't pushed out onto the street. And that ended under Governor Rowland when Ganim was looking for former mayor and now mayor of Bridgeport, Joseph Ganim, wasn't getting the reimbursement he wanted for the people in his district. And they had a lawsuit suing Rowland for the money, and Rowland said he didn't have to give it to Bridgeport. And then they just pretty much shut down the General Assistance Program, so that it's now, or the State Assisted General Assistance Program, it's now at $219 a month if you're in this situation. You have to be looking for a job, or you have to be applying for disability, and then you can get the $219 a month. But it's a very, very difficult situation, and it doesn't really help that much.
No, no, it really doesn't. Most people that I see are if they're getting Saga Cash, they're getting it because they've applied for Social Security disability, and they're waiting, which is usually about a year wait to find out. And during that time, it turns out that they don't want you to work, because then you're showing that you don't need disability. So, so it's kind of odd that they say, well, you should just live on $219 a month, while we decide if you actually have a disability.
It's a very stunning and strange way of operating to try and again, this is a cost shift. So we want to be clear that this is a shift from the state of Connecticut to the local communities. The communities that have the least ability to support our homeless are put in the situation of supporting the homeless. So it would be Hartford, Bridgeport, Waterbury, New Haven, Willimantic, New London. All the urban areas are the places where the homeless shelters are. They're not in any of the suburban towns that I'm aware of.
That's true. We are fortunate that we get support from the local towns around us that don't have homeless shelters, because they recognize that sometimes we're taking people from their communities into our shelter. So that's very nice.
No, it's very good. I was very pleased to see, for example, Mansfield made a donation.
Yes.
But then they said, what's Wyndham going to donate? And I'm there already. Well, we donate already $6 million to all the nonprofits because they don't pay tax here.
Right, that's true.
And that's
true.
a $6 million bill that we have here in Wyndham. And it's the people care very much here.
Mm-hmm.
They want to make sure everybody's cared for.
Mm-hmm.
But, we are already donating.
Right, right. Yes. And Town of Wyndham also supports us. So, so we're grateful for that always.
Yeah, it's a very good community. It's a very caring community. It's a community that's really open to everyone, and that I'm very, very proud and honored to be able to be the representative for a community like that. But I just want to make sure that we're clear about that. Wyndham does do a lot for all the nonprofits here.
Yes, I know they do. And I have to say that I chose to live here in part because this is a community that takes care of its people, and I love to see that. You know, they really do.
They do, and that's great. And I'm so glad you're here because you're doing amazing work with the No Free Shelter and helping all the people. And now I know that you have some other very interesting information, kind of along the lines of what we're speaking of, and it's the pending humanitarian crisis and the homelessness in Connecticut. And as we started off the show saying, we're about 120,000 units short of housing, and we also have a very poor social safety net, although I have worked very hard to improve it for the women and children. I hope to also maybe help out with the State-Assisted General Assistance Program. But tell us a little bit about the pending humanitarian crisis that we're facing with.
So I have a little bit of data that talks about our CAN, and the CAN is called the CAN because it stands for Coordinated Access Network, and so the state is divided into 7 regions. Each one is called a CAN, and we work together with the people in our region, the agencies in our region that have anything to do with homeless response. And so it's actually a really great way to go about having a system that really works. And in the end, what this does, the CAN works together. These are all agencies that are independent from one another. The Eastern CAN is almost the entire eastern half of Connecticut. So it goes from Thompson all the way south to New London and Mystic. And there's about 25 active participating agencies in the Eastern CAN region. And we work together. We meet with one another. I go to meetings with other CAN providers almost every day of the week. We have something going on with everybody, and it's great because this is all about getting people from homelessness to housed. And so I work with housing providers. I work with mental health and addiction services. I work with community action agencies. We work with outreach. And because of this, we've developed some really wonderful collaborations with other organizations. But homelessness is on the rise in Connecticut. And in the Eastern CAN alone, there are right now 489 people who are homeless in Eastern Connecticut. Of these 489, 78 households are unsheltered. So that includes some families too. 78 are unsheltered, which means they might be sleeping in an abandoned building or in a tent or in some place that's not meant for human habitation. It could be a car. They could be sleeping in a car, that kind of thing. For the first time, in our history of having a can, which has been many years now. We have a waiting list for shelter beds for families. And in the past, it used to be that if we knew that there was an unsheltered family, that's a family is defined as any adult or two adults with minor children. So, so if there's a family that is unsheltered, we've always found a way to accommodate them in some way, even just if it's just for a couple of nights until we can get them regular shelter beds. We've always been able to do that, and at this point, we can't. We have 4 families on the shelter wait list, and this is very, very concerning to know that there are families with children outside, either in a tent or in cars or something like that. It makes me so sad.
It's very sad, and it's very traumatizing to the little ones, and it creates a problem. We know we're faced with a mental health crisis all throughout the country and in Connecticut as well. And part of the mental health crisis is not having the kind of social safety net that every other country that has any kind of wealth provides to the people. They provide people a way to get their step up so that they can participate in the economy. It doesn't help anybody to have to exclude people from the economy like we're doing right now. The only thing that we can do as a society is to really make sure we have people we can have them participate. And the way we get them to participate is to first make sure they have stable housing, make sure they have enough money to feed the children and clothe the children, make sure the education system works well for all the children all over the state. And then make sure training is being provided to people who can be trained and move into a type of a job that will help them pay the rent. And as we started off this conversation, we know that $15 an hour does not pay for a regular place to live in the state of Connecticut, and it gets worse probably every single month. The price of a apartment goes up. Mm-hmm. But we know that we needed between $25 and $30 an hour for our people to be able to afford a decent a place to live, pay the rent, and that sort of thing without a subsidy. So those are the kinds of things that we realize, and we have to be able to step up so that we can include everybody in the economy.
That's true. It's something that we really need to address because there's a couple of things happening right now. One is length of shelter stay. So people who go into shelter, we try to get them out of shelter and into housing in 30 days. Right now, that's impossible because there isn't enough housing stock, and if we do find housing, it's usually not affordable. So we have kind of a backlog of people. Our average household in Eastern Can stays in the shelter now for 172 days. And we want that number to be 30. So we have a lot of work to do to get people out of shelter. But what that does is it also means that there's now not enough shelter beds. And so because they're all full and people are not moving out of the shelter. So that means that there are people who are more and more increasingly sleeping outside or in unsheltered conditions because more people are becoming homeless. And people are at greater risk for homelessness, even if they're right now stably housed. It's, that I don't have the statistic, but how many people right now are one paycheck away from losing their housing, just living every month trying to figure out which bills they can pay and which bills can wait another month and that kind of thing, and what can they give up to be able to afford to stay in their housing. It gets very, very challenging for people.
It certainly does, and that is the kind of difficulty that we see people faced with all the time in your job, and also the Department of Social Services. We have so many more people that are looking for housing, looking for supportive services, and we at the Department of Social Services we have fewer people working there than we did back in 2000. Yet we have we have twice as many people who have Medicaid needs, may just qualify for Medicaid, or have housing needs. There are all kinds of programs and that they could maybe qualify for, but to try and make sure that the systems work at the Department of Social Services, which are relatively new, the scanning systems, all of these things are things that we're working on at the Capitol to try and make sure that we have enough in the way of work and support to process claims that people are eligible for. And it's something that, it's quite a difficult situation, because everywhere you go, because we didn't create a good, solid social safety net back in the day in the 90s. We're now paying for the fact that we didn't do that back in the 90s. We cut back, whether it was on the national level, where we in the 80s had limited the Section 8 program, the building of housing by the Department of Housing and Urban Development, and just go into the subsidies under the Section 8 program, whether we cut out coverage for mental health services back in the 80s under the Medicaid program, whether we did all kinds of different things that cut back on services here in Connecticut. Again, I'll mention the State Assisted General Assistance Program, going from helping people pay their rent, pay utilities, help them with food and medical care until they could get back on their feet and not have to lose the place that they were living. That all got cut back in the 1990s under the Rowland administration. And so people forget about all these different programs that we had. And when you go to TANF, you go back to the Aid to Families with Dependent Children, where you had that money coming in until you actually were getting onto your feet and employed, so that the little ones didn't have to live in a homeless shelter. The little ones weren't threatened with living in the car back in those days. You didn't have those kinds of problems before we changed to the Temporary Assistance for Needy Families, before we got rid of the State Assisted General Assistance Program to the point where we're only giving $219 a month to people applying for disability. And then it takes forever to get on disability most of the time, so they're stuck.
Yes, I agree. And the social safety net is a big issue. One of the programs that I'd like to develop at the No Freeze is a homeless prevention program, where we can be working with landlords and tenants on preventing evictions and helping people not be evicted. Because another problem is, of course, is if you have an eviction on your record, it's very hard to convince a landlord to rent to you again. In this day and age, it used to be that when there was plenty of housing available, landlords would be willing to look the other way or give people another chance. But now, if there's any kind of criminal history, or if there's any kind of mark on somebody's record, it's very hard to convince a landlord. So I'm hoping to create a program at the No Freeze where we can prevent evictions and save people from becoming homeless. And I have a lot of ideas around how that's going to work. I'm just waiting until we make this transition, at least the first part of the transition, before I can start something new.
Well, I know you're a very busy person, and this transition is going to take a lot of work from you and the people who work with you to make sure that everything's going to go as you planned. And it's going to be a very good thing for people who are living in these very, very extremely difficult situations. Mm-hmm. And I hope that we've really made it clear that so many people who are in this circumstance are suffering with some type of health issue. And those kinds of health issues are problematic. And I guess there's also a difference in how the state of Connecticut operates its SNAP benefit in terms of how food resources are obtainable by people who are in homeless situations.
It's really interesting. Some people kind of get different amounts in their SNAP benefits depending on whether they have a house, an apartment to live in. They might get their benefits cut because they're homeless. One of the things that I thought was really interesting was I read about when Texas got hit with that terrible hurricane a few years ago, and many people had to go live in hotels, and they were SNAP recipients. They were able to tailor their benefits so that they could then buy restaurant meals because they were living in hotels and had no cooking facilities. So SNAP was able to just for this very specific population. It wasn't even a statewide thing. It was just for the people who were affected by the hurricane that they could change their benefits to allow them to, for instance, get some dinner at McDonald's or get restaurant meals and things like that. And it makes me wonder why that can't happen for the homeless population because SNAP benefits pay for food that needs to be prepared and that doesn't pay for prepared food. You can buy at Stop and Shop, you can buy all of the parts of making a sandwich, but you can't buy a sandwich that's already been made. And for somebody who's experiencing homelessness, it would be so much easier if they could get something that's already made because they don't typically have a way to cook.
That's right, they don't. And that's an interesting observation by you. And I'm wondering if maybe the emergency occurrence, so when you get a state of emergency, it might have had something to do with how how that happened. But it should be a state of emergency for anybody who's homeless.
Exactly. That's why
they're in a state of emergency until they're housed.
Exactly.
And getting the services that they need. And I'm glad to hear that the CHESS program may be reinstated because I did mention that at my last meeting with the Medical Assistance Policy Oversight Council.
I hope it is because it's a great program, and we had a number of people that were housed with that program, and it's so exciting when somebody goes into housing. We just love that.
Well, it would really be good for you to send me a note about that because I'd love to hear some more, and I'd like to be able to send that off to the commissioner and also the group that I'm working with, Eastern Regional Council of State Governments, and we're working on different issues to try and figure out ways to get additional housing for people that may be thought of in terms of, not obtainable, let's say, for all a variety of reasons, which I won't go into at this point. But anyway, any last words?
I would just want to thank our community for all of the support that they show to the No Freeze Project. We could not do the work that we do without the donations and the support and all that you've done. And also, I just want to thank the town, too, who's been really wonderful to us ever since we moved to that location. It's been very nice to have the support of the town. I also just want to say this. We really need toilet paper. If anybody has an extra roll of toilet paper, you could drop it off. That would be great. Thank you so much.
Okay, that's a good last word. Thank you so much, Avery Linhart, the Executive Director for our No Freeze Shelter here in Windham. Thank you so much for being with us today, and thank you for all the good work you do to help the people.
Thank you.